I'll give 1 minute to everyone who's standing to, just grab a seat, find a place to patch your bag and yourself, sit. I would encourage all of us to sit next to somebody we haven't met. Okay, don't move around. Okay, don't move around, but I would have loved that, but it's okay. The way we are, it's okay. Okay. Welcome, everyone. Thank you so much. And it's so good to see people that were in our opening event yesterday, our first Lives in the Balance. So really good to see all of you, the new faces, the old faces. Thank you so much for being here. And this is our second Lives in the Balance event happening on the sidelines of the World Health Assembly. And why I am so excited and so pumped up for this session is because we are going to spend 2 hours talking about a group of people that are the future of our countries. Yes? We are spending 2 hours talking about young people, 1.8 billion young people in the world today, the largest cohort we've ever had, and people whose aspirations and achievements literally will drive the future of what we all want to do. So a round of applause for every young people or every young person in the house today. And also a very big round of applause for everybody who does not make the cut because of their age, but who is young at heart. Thank you for being here, and thank you for just coming to support and listen to these young people and their achievements and their dreams and their aspirations and what they would like to see us change and what they would like to change. And that is essentially why we're here today. My name is Mercy Juma. I am the BBC News East Africa correspondent, but like I always say, I'm a very big champion of adolescent health today and also of women and newborn and child health. All right, so to start us off for this session, please, let's watch a video. You can definitely tell it's going to be a fun event. And those who saw me yesterday, you probably saw me in high heels, right? Today, I came ready. I came ready to dance and to, match my energy with all these young people. Please welcome on stage Mumbi with her poem 1.8.
Hello, can you hear me? Yes. If you can hear me, clap once. If you can hear me, clap twice. If you can hear me, clap slow motion. 6 people, awesome. So on behalf of the 1.8 billion young people around the world, How many more movements do we need before you realize that fighting to have a voice should not be our own self-adventure? How many more poems, chants do we need before you move and give us a chance to realize that young people are creative, innovative, sustainable, with goals and ideas that with investments are attainable, but still you tell us to follow you and listen without questioning. But I think that says less about us and more about what you think of your own parenting. So we are tired of demanding your understanding. Our world has the most young people it has ever had, so I am calling to all my fellow young people from every part of every hemisphere to continue with the songs that we sang last year and the year before that. Hatujachoka. We are not tired. We are inspired by the creative ways we continue to take up space. My grandmother's legacy and will is what I embody. I do not protest as a hobby. So to you, the 1.8 billion young people, keep making your voices heard, because that voice is the same one we will use to rejoice. Those voices are the same ones you will use to give others not only options, but choices. You are the moment. So with all of your might, speak with the same conviction God spoke with when he said, "Let there be light." Thank you.
Thank you very much, Mumbi, and very, very proud to be a fellow Kenyan. Yeah? Yeah, Kenyans in the house. Yeah, thank you so much, Mumbi. Now, I have a question for you. We will revisit, what Mumbi has asked for in her poem, and that basically forms the base of our discussions today and what we are going to do today. And we are going to allow all the young people that will speak here today to put us on the spotlight, yes, and give us assignments and tell us what they want us to do and tell us what they want. Probably in the next couple of minutes in our interaction, there are phrases that you are definitely going to hear a lot about. What young people want is one of them. And Mombi has addressed that in her poem. The other thing is definitely the 1.8 billion young people, and I will add for change because it's a campaign that has really gained momentum in the last couple of months, and it is spearheaded by the PMNCH. Thank you so much for hosting us today and for all the incredible work you are doing around the health and well-being of young people and adolescents. So you'll hear that phrase number 2. Phrase number 3, and something that you should all look forward to, is what we are calling the Global Forum for Adolescents. That is going to happen in October of this year. And I can assure you it's going to be the largest congregation of adolescents and young people that we have ever seen. And I'm so excited to see what they are going to achieve. And this session is just going to be a pace setter for what is going to come in October and next year and the next couple of years as they take lead, because that's what we want them to do, right? So I have a question for you, for all of us in here. And we're going to do this on Mentimeter. And we are asking, what is required to ensure SRHR needs of adolescents and young people are met? And SRHR is one of the topics you're going to cover here alongside other issues, but it's really interesting. I want to know what your answers are to that. There is a code there, and you can use that to input your answers. Let me know. And as we go along, I will sample some of your answers. What do you think is required to ensure the SRHR needs of adolescents and young people are met? Now, our first panel is purely young people, and there's no better way to start this than doing that. And what we are going to talk about is just their lived experiences and what they are doing and what they want to see done, like I said. So with me on stage, please welcome these 3 people. Delali, a change maker and student from Ghana. Thank you so much and welcome on stage. Katia Sik, welcome on stage. And Miret, your Egyptian doula. Where do you want to sit? All right. So, like I said, for this session, I just want to hear, and for everybody here, to know about your experiences, what you are doing, the challenges you're facing, the gaps you are facing, as young people really championing for your health and your well-being and your rights. Yes. And I will start with you, Delala. How are you? It's on. How are you?
I'm fine.
You're fine?
Please,
How are you
yes.
feeling?
Well, I'm feeling good.
Good. Are
Yes,
you
please.
excited to be here?
Please, yes.
Awesome. So happy to see you from the mother continent. Now tell me, Delalai, how is everything for you and the young people in Ghana?
Okay, first of all, my name is Delali, a change maker from Ghana. I deem it a very great honor to be given this opportunity to express my view on issues against us. I advocate on violence against children, especially child marriage and teenage pregnancy, because in my community, teenage pregnancy is a rampant issue in my community. And that is what leads to child marriage, because once you entered into teenage pregnancy, they'll give you to the man to marry. So I'll talk about menstrual hygiene too as a root cause, because menstrual hygiene, although a crucial component for girl child education, less attention is given in most Ghanaian schools and communities. And majority of girls in communities, particularly in Kwaikese, where I was raised, struggle from menstrual related issues like lack of access to menstrual hygiene products. And this occurrence leads to what? Contraction of infections. And teenage pregnancy is one of the occurrences in the community, because in order for them to raise money to get this sanitary products, they end up in premature relationships, leading them into teenage pregnancy. And also, this is because Ghana is known as a middle to low income economy, where communities are plagued with low socio-economic status. So during that too, I think high cost of sanitary products are the main cause of such issues. And because of that, I recommend the government should increase taxes on sanitary products, to rather reduce taxes on sanitary products, so that it can be affordable for girls, so that we won't end up in premature relationships. So as a girls president in Case Club in my community, we organize kids festivals where we invite our parents and educate them on issues affecting us. And we let them know that we girls especially are not biologically mature to carry on parental reproductive responsibilities. Therefore, we need to put a stop to child marriage and teenage pregnancy.
Thank you very much. And I'll just cut you short there. She raises very, very valid and very strong points. And probably what resonates to most of our societies and our countries, not just about Ghana. And I would really want Kaji to jump in here. And do you relate to anything that Delali has talked about?
Yes, very much on a deep level. However, perhaps from a little bit of a different perspective. And that's more on the side of education as well as health literacy. This is also a part of the fight when it comes to SRHR, as well as breaking the stigma. So for example, since I'm a part of the International Youth Health Organization, we work a little bit differently. We're not completely at the grassroots, but we have youth organizations in different countries that work on these issues. So what we see, for example, a lot of the times is that health literacy and the lack of education when it comes to SRHR still continues to be a problem. And how can you, for example, make something better if the young people, adolescents, but even decision makers are not really aware of what is on the agenda, of what we are talking about? Like you can give young people, for example, you can give them condoms and so on, but if they don't know how to use them or why should they be using them, you haven't really done anything. Also, when it comes to education, what we're still seeing in many countries around the world is that the education is either not there whatsoever, that there are still certain topics that are very stigmatized and not even addressed whatsoever. And also that sexual and reproductive health and rights as a topic is very segregated amongst genders. So what does that mean for boys? What does that mean for girls? What does that mean for any other gender out there? And does it even include different gender perspectives when we're talking about SRHR? So in terms of that, health literacy is an element that is very often forgotten. And one such thing is, for example, we were talking about menstrual hygiene products, right? And oftentimes it seems very weird when you can't have a dad or a brother or a boyfriend, go out and buy menstrual hygiene products for their sister, mother, wife, whoever it is. Why is that? And that is because the society and the stigma that is present there very much influences as to what we are being taught when it comes to SRHR in many, many different ways and many, many different topics. So perhaps from that sense, I can relate to what was said before, that this lack of information and that young people don't really know what to do with this information then really impact and prevents them from being active voices in the society and fight for the improvement in their community.
Thank you, Karja. And Meret, you have agreed so much to all the comments that have been made by both Delali and Katya. And as you give, your own experiences, I have heard you really speak passionately about, when we are addressing issues around adolescence, whether it's SRHR, whether it's child marriages, whether it's on menstrual hygiene, you always talk about what you call a multi-sectoral approach to looking at all these challenges. So can you just mention that as you talk about your experiences?
Yeah, of course. Thank you again, Mercy, and thank you again for the opportunity to be here. My name is Mirat Khalil, for those of you who don't know me. We look very differently when it's not very early in the morning at Walk the Talk. So, no, I'm the founder of Your Egyptian Doula. So this is actually one of the first doula organizations in Egypt, my home country. And this organization was started with the mission to educate, advocate, and empower expecting parents to be able to self-advocate for themselves in a unfortunately broken system. And really the ultimate objective here is to work on the elimination of obstetric violence. So one of the issues I'm seeing a lot in my own community and I want to share on is the fact that the main risk or the main problem that women and girls face in my country is the threat of the knife. And here, what we're talking about is that women are faced with this risk of getting cut throughout their life. So as whether it's FGM, when they are still adolescents, younger, whether it's the knife of over-medicalization and the C-section epidemic we're seeing in Egypt currently, during the time they're having their first child or ultimately other subsequent deliveries, or the knife of femicide. And unfortunately, as mentioned by the fellow panelists here, this is also similar in my own country. It's compounded by the limited decision-making autonomy that women have, especially that girls have. And in addition to that, the stigma and the low literacy, specifically body literacy and health literacy, especially when it comes to SRHR. It's still such a taboo, and it shouldn't be. And of course, to tackle taboo and stigma, to tackle a C-section epidemic, to tackle FGM rates that are not going down in more than a decade in Egypt, we need a multi-stakeholder approach. The health system alone, health providers alone are not going to be able to do that. We need financing, we need policies, we need legal structures. And I'll share a couple of examples based on these three knives that I shared about here, to give you an idea of what we're facing in Egypt and how we really need to start working together in a more unified way. So a recent study came out last year, literally just 2020, that said that more than 85% of underprivileged women between the ages of 18 and 35 had undergone FGM in Egypt. 85%. Scarier number is that that number has only gone down by 1% in the last decade. And I'll tell you, my mother was, I'm raised by an advocate herself. My mother was working on FGM at the beginning of her career, decades ago, working in the space of maternal health, in sexual reproductive health and rights, in advocacy. And the reality is that even in Egypt, this is still very common. Girls between the ages of 9 and 13, even as young as 6, will undergo FGM. Mm-hmm. And the truth is, most of the time, this is happening in health facilities. It's the medicalization of FGM that we're seeing. And even though Egypt has introduced legal measures to start trying to address this, it's still happening in health facilities. The one glimmer of hope when we're talking about FGM is that actually the daughters of survivors are much less likely to be cut because of the traumas that their mothers have experienced. And the reality is the younger generation of mothers, whether they are teenage mothers or younger mothers, they are the ones that are starting to push back on this. Mm-hmm. The second thing I just want to mention, Mercy.
Very briefly.
Very quickly. is because really this is at the core of the work we do at Your Egyptian Doula. It's really starting to push back against this C-section epidemic that we're seeing in Egypt, the second knife. And what we're seeing here, actually, Egypt, unfortunately, has one of the highest C-section rates in the world. And I see many nods in the room, but I mean, really, we're talking about 9 out of 10 mothers, and that's a low estimate for who's going to be experiencing a C-section at their first birth and subsequent as well. Mm-hmm. And the problem here is that this has become so normalized. It's become normalized for mothers to enter hospitals expecting disrespect and abuse, expecting to be traumatized in birth. And the reality is, from what we've done in Egypt, it's the younger generation that is starting to really push back against this whole thing of it's normal.
And that's
no, it's not normal. Right? It's not normal to experience abuse. This is why we need to continue to advocate for respectful and rights-based care, especially for the younger mothers that are entering health facilities that we know are going to see so much more crueler and harsher treatments in facilities.
Thank you very much, Meret. So basically, Meret is telling us we should stop normalizing the abnormal, right?
We should stop normalizing abuse.
Yes, yep. Which is the abnormal. And thank you so much, the three of you. I know we have a long journey to go and to talk about these things. And you raised very valid points. We're talking about child marriage, menstrual hygiene, the need for better financing, better policies, legal structures, and most important, that we need to work together. Thank you so much, the three of you. I will allow you to walk off stage so that I bring on board people who are going to respond to what we have talked about here, people who are going to talk about, reflect about what these three lovely ladies, change makers, have talked about, and tell us what they are doing and what we should do differently. So our next panel is comprised of, technical experts, people from the government, international organizations, and your task is, like I said, reflect on the comments made by the young people and how to address them, the good practices in your states that other people can adapt. So please, ladies and gentlemen, allow me to welcome on stage Natalia Kanem from the UNFPA. Senator Lauren Clifford Lee from Ireland. It's a pleasure to have you here. Thank you. Dr. Ruth Laibon Mersha from the motherland, Kenya. Welcome on stage. And lastly, Jimena Aguilera, Minister of Health in Chile. Welcome on stage, ma'am. I know COVID was declared to be no longer a public health concern. And I don't know if you will judge me if I hand this mic over to Jimena because it's supposed to be on this seat and then I go to the other side. Or do you think I should still obey the protocols and humbly ask Jimena to move to the other seat? I will go with what you decide. No, it has to stay on that seat. Thank you very much. All right. Are we ready to react to what I think it's very, very difficult to come after such a vibrant panel, young people who, really know what they want, right? I'm so sorry, but Natalia, you're the first person I'm going to put on the spot. Good to have you here. And we have talked about so many things, we have set so many agendas, and one of them being, the SDGs that are a great tool, I would say a Bible on how we do everything around health and well-being. And there are indicators there that talk about young people, but I don't know if they are enough and we refer, to them enough. And I'm really interested in knowing, and the young people here have asked me to ask you how UNFPA is working with governments to make sure that issues around young people and adolescents and their health and well-being is addressed.
Well, thank you so much. Really happy to be here, Honorable Minister. Delighted to see you, parliamentarians on the podium, and the young people. Urgency requires this conversation. In November, we marked 8 billion in the human family, which is great. Adolescents and young people are almost a quarter of that number, the 1.8 billion. So, speaking openly and truthfully about the needs of a quarter of the human family is apt, if difficult, and I think the first panel certainly showed us. Right now, somewhere there's an adolescent girl sitting with her head in her hands. She has missed her period. She does not know what next month is going to bring and whether she's going to be kicked out of school. And the prospects of her completing her education are dimming in front of her eyes. And as I speak, there is a young woman on a hill, on a seaside, who is expecting to deliver, but there's no midwife in her community, and she doesn't have transport money to take her the 15 miles to the clinic, right? So without a midwife at hand, what is going to happen to her and the newborn? Now, when I think about the dilemmas that young people are facing, I see a teenage boy who is wondering, post-COVID and all the isolation and all of the social media that he's been exposed to, not feeling well with anxiety and other issues, and who realistically is he expected to turn to? So I think as UNFPA, when we look at the avalanche of misinformation, the inequalities that are so fundamental in terms of access, when we think about homophobia, the taboos on sexuality, all of this is putting young people and their well-being at risk. And it is important to open that path, not just to access services, but as we saw, the leadership of young people to express what it is that they want and how they want services delivered. UNFPA, yes, is an intermediary to governments, but what we're also seeing is that young people can be very effective in terms of self-advocacy, and groups like AFRIAN, YPeer, the ones that we just heard from, are making huge strides in terms of self-representation. I believe that these structural and cultural and legal barriers to young people obtaining sexual and reproductive health information, the services that they need, having all this confusion of messaging that they're bombarded with, have serious ramifications to health and well-being. And comprehensive sexuality is not controversial, right? The reality is that CSE helps young people to be able to navigate their adolescence. I will also add that from the perspective of UNFPA, the convening power of a PMNCH, of a Nairobi summit, of the SDG summit upcoming, and next year ICPD at 30, is to push the proposition that if we're going to make promises at the global level, if a government is going to make a commitment, the follow through in data and monitoring has to be there to hold people accountable. There's a lot more that I could say, but the basic fundamental thing is that it takes young people and older people together to build a society. And we have to live up to that proposition of opening the door for young people's leadership. Thank you.
Thank you very much. Leadership, that's what you talk about, and the ability to be able to hold hands of these young people, right? And this is where I bring Senator Clifford Lee. You know, you have done marvelous work around, you know, progressive legislation. And I will single out issues around providing free period products and ending period poverty, something we have talked about here. The young people have mentioned as an issue. What do you think is the way forward, especially from a legislative point? What is the role of legislators when it comes to just ensuring that the harmful practices and norms and discrimination and violence that young people are facing are something that we will not be talking about in the years to come?
And thank you very much, Mercy. And I'd like to thank you for inviting me to be part of this very eminent panel and following our young leaders and the excellent contributions that they made. And I was really struck by all of them, but particularly Delali and the way she spoke about period poverty, because it's something that we experience in Ireland, and it's something that I have been working on for a number of years. In 2018, there was a Plan International survey done of young Irish girls, and 50% of them had experienced period poverty, and 10% of them had been regularly using inappropriate period products. And this was really, really shocking for me. Ireland is a rich country, and it was shocking that 50% of young girls experience period poverty. So it's something that I decided to advocate upon. And I was, you know, a lone voice for a long time. I spoke in the media, I spoke in Parliament about it, and I got such amazing feedback from young women that I met around the country and in my own constituency. And I actually had one young woman say to me one day, "You're the first politician that I can actually relate to because you're speaking about something that's important to me." So as a result of that work in 2018, it led on to the Women's Caucus within the Parliament putting motions before both chambers of Parliament on the issue of period poverty. And it allowed us time to debate this and raise the issue, but it put period poverty firmly on the political agenda. And that was really, really momentous. We had a general election in 2020. And following the election, 3 parties entered a coalition government, my own party being one of them. And in the agreed programme for government, there was a direct commitment in relation to period poverty. And this was really, really major. It meant it was going to happen. And the Minister for Health, who's a party colleague of mine, has a particular commitment to sexual and reproductive health and rights and women's health, because of course, as we all know, Ireland had been laggards for so long in this area, and change came, and it came really rapidly in the end, and it came from young people out in the streets demanding change, and we've made amazing leaps forward, but it was the advocacy of young people, generations of young people actually got us to that point. A subcommittee was set up, and that subcommittee reported on the extent of period poverty, highlighted particularly at-risk groups, and we developed a strategy from there. I put down legislation in the Senate, and pilot schemes to provide free period products have been established around the country, and they have been rolled out at a rapid pace around the country. So it's made a really, really big difference. So I think our role as legislators is to listen to people firstly, and not live in an ivory tower, talk to people, whether it's in schools, in communities. I'm regularly around in various groups of young people because I want to know what's important. And then it's to act on the basis of best practice and on the basis of science as well, and get our information from the UNFPA, from the WHO, and put to bed stigmas and taboos, and really focus on what's best practice. And that's my role as a legislator, and I'll keep doing it for as long as the people keep me.
Oh, thank you very much.
And actually, Mercy, if I could just make one further point just in relation to the unintended pregnancies, we introduced a free contraception scheme. So by this September, all women under the age of 30 will get free contraception. Now, we don't have the data on that yet because it's a new scheme. It was just introduced a year ago. So we don't know yet the impact that that will have on unintended pregnancies, but the uptake has been amazing, and it will be eventually rolled out to all women of all ages. So we're really happy about that.
Wonderful, wonderful news. And yes, we will probably ask you to come back here when we converge again to hear what impact that has created, because definitely it's a big thing and something that is valuable to our young people. And you know, when we talk about legislature and legislations, and I come back to my home country, FGM, we spoke about FGM here, Meret, something that is really, really passionate for you. And Ruth, you know, probably it's something that has put Kenya on the headlines when it was really bad in a bad way. But when the government and stakeholders pulled hands together and made progress, then it's something that we are proudly saying that we have done something, and we are continue working on it. So, you know, how was the government successful in applying a multi-sectoral response, you know, to make the FGM numbers go down? And what more do you think needs to be done to ensure that we no longer talk about this, that we still have young people and adolescents and even mothers going through FGM?
Thank you very much. And, you know, one thing that when today I was told I was coming for this session, I just laughed out because I recently put out a post on my Facebook that at the age of 20, I was getting the girls to march and say no to female circumcision. She just said your mother was doing that. That was my first career on a program funded by UNFPA. So it's not a coincidence. And I was a volunteer. And by then, this small little community I was working with had almost universal practice of female genital mutilation and female genital cutting. But at that age, I kept wondering, why can't the girls say no? You know, why can't they just wake up and say no to this practice? And this UNFPA program was trying to help us address cultural practices, but also look at how we can actually do in the practice. And so I began to first work with the girls. And then I realized there were circumcisers who were making a living out of it. So I had meetings with circumcisers. And then I was told, no, it's the boys. And so I had meetings with young men, boys. And finally I said, so what is it? Because everyone kept thinking that this is something they can all do. So along that year, I was told that there was one secret about this community that I needed to know. That the old men, a council of elders, had put an unwritten rule that if the uncircumcised girl made for them some porridge that was being burned by hands, they would not drink it. So I said, really? So they said, no matter how much money you spend here, this community is not going to change. Then I asked someone, where can I find the men? And they said, oh, they are council of elders. It's a community called Meru, and they live and organized in a very good way, just like your parliament. And so we visited them and we asked if we could speak to the leaders, and ultimately they did accept that after training, they would ban the circumcision in their community. The rates came from 98 to about 38% within a year. And that was the basis that we started alternative rite of passage that came to become a movement in the country. But then that's just one part of it. So a lot of things that then happened thereafter were about the environment, the legal environment, the legislative environment, and getting people like you, champions like you, go to parliament and put up laws to support the work that was going of educating people. But also something else the young people have brought out, education. Where education levels were improving, then we were seeing the practice going down. So in some of those communities, there was a bit of investment on education for girls. But ultimately, the law did do something. But it was not the law, just like Natalia said. It was the law with accountability platforms. So the country put up a board, the anti-FGM board, that they don't do anything else. When they wake up early in the morning, the only thing they do is to monitor and put communities, put government, devolved governance, put units into an accountability platform, and they keep the agenda alive. So the law alone didn't get us to zero. The law, accountability, but also trying to see how we build the agency of the girls. Unfortunately, I must end by saying that, for me, when I was 9 years old, I had this little girl who was my friend, my community circumstances. And one day we were playing, the next day we were not. And I looked for her and I felt very miserable because the game we used to play was the ball that you pass around. And later she was circumcised. When she came out, she was not speaking to me. She was already a woman. The last time I saw her, she had 7 children. And those 7 children were born from that age of around 9. So we must not forget that when you speak about practices such as FGM and the interlinkages with what they do to that girl, I'm sure she'll be here with me today probably because our families are not really different. But the pathway that was chosen for her took her to become a mother, took her to now look like, if I meet her and me seated here, she looks like my grandmother. So I think in reality, we must look at some of these practices and the investment case that countries are making to ensure that we are speaking not just to the cat, but to what it does to the entire economy, to the entire society, and to what it also did to this girl, for example, I'm speaking about. So for us as Kenya, we say success. We have seen prevalence from 38% to 12%. We have seen that ages of circumcision are lower for the young people. And that is the agency that the young people have called for. Can they have the agency? And Natalie, we can't invest in agency if we can't invest in education. Where do we get them? We can't go speaking one-to-one. We have to put money to provide that education. So unless we speak the same language, and then we put the money behind our language so that we give them the platform that they can then use to sustain that high-level advocacy that they have done, and as well as the low-level advocacy amongst their peers, then maybe we will then sustain the gains we are making. Thank you.
Thank you. Thank you very much. Thank you very much. Now, I know we have questions, as always, and we will come to that. Thankfully, not like yesterday, today we have a few minutes to spare for us to ask questions to all our panelists. But before we close this panel, I will go to Honorable Jimena, and Honorable Jimena will speak in Spanish, so you can use your headphones for the translations. And a big shout out to everyone who's watching us online and following these conversations online. Please go to the Spanish channel to listen to the English translation for our next speaker. So, yes. Save the best for last. We've talked about adolescent pregnancy and childbearing and, the negative health outcomes that this comes with. We are talking about best practices here, and it will be good to just see you discuss, what your government did and how you put all these in the national agenda, how you build up support to scale, adolescents prevention, pregnancy prevention programs, and most important, what resistance or challenges you faced or are currently facing as you try to work this out. Thank you.
Muchas gracias. Primero, agradezco la invitación a este panel. Bien, el tema del embarazo adolescente en Chile es algo que se ha trabajado primero por décadas, no es algo que se haya logrado trabajar en un periodo corto, y esa es una de las lecciones que nosotros tenemos, en el sentido de que primero hay un sistema de salud que garantiza una cobertura, un sistema de salud que se comenzó a construir en la década del 50, fue el segundo sistema de salud nacional después del inglés, segundo o tercero, y que tiene una fuerte presencia en la atención primaria de la salud, con programas de control de natalidad, de acceso a métodos anticonceptivos desde la década del 60, donde el Fondo de Poblaciones nos ayudó mucho en eso, los organismos internacionales. Entonces, primero hay un trabajo en lo que es las prioridades de la salud reproductiva, primero, por supuesto, basado en la salud maternal y la salud infantil, pero que construye un sistema en el que hay una estructura base y una posibilidad de acceder a los recursos especializados en forma poblacional a través de programas de acceso a anticonceptivos que son gratuitos para la población desde esa época a través de la atención primaria. Posteriormente, ya en los últimos 20, 25 años, empieza a trabajarse el tema de la salud del adolescente, los programas de salud adolescente. Entonces, también son algo que se ha instalado a través del tiempo. Cuando era ministra de Salud, la presidenta Bachelet fue ministra de Salud el año 2000. A mí me tocó definir los objetivos sanitarios de su gobierno cuando ella era ministra. Y nosotros pusimos entre las metas 0 fecundidad entre los 10 y 14 años. Eso fue el año 2000. O sea, ya ahí se señaló una meta política de llevar a 0 la fecundidad en las jóvenes de 10 a 14 años. Y a pesar de que no se ha logrado totalmente, se ha avanzado mucho y se ha logrado reducir la fecundidad en adolescentes. Más se ha reducido en las mujeres adultas, y por ende todavía la proporción de embarazos en adolescentes no es relevante, pero es más en las mujeres de 18, 19 años de edad que en las menores, donde la verdad es que ha sido poco frecuente. Pero en lo que quiero resaltar es el hecho de la construcción de un sistema y de una política definida y de definir metas y avanzar a través de los años. Esto va en paralelo con el avance de los otros sectores de la educación. La educación en las niñas ha mejorado mucho a través del tiempo y por lo tanto se le da más alternativas a la vida de las mujeres que solamente el embarazo o el criar niños, que también es una alternativa válida, pero las mujeres tenemos derecho a decidir en qué queremos desarrollarnos, no obligarnos a un cierto carril, que es lo que se supone que debemos hacer porque la cultura lo permite. Entonces también está el hecho de avanzar en otros sectores, en la educación, en tener más alternativas, y eso también ayuda. Ahora, ciertamente que han habido muchas dificultades. En Chile es un país católico, donde la Iglesia ha tenido un rol muy relevante, tuvo un rol muy relevante en la dictadura, en la lucha contra la dictadura. Por lo tanto, cuando se recuperó la democracia tenía una preeminencia muy fuerte. Entonces, a pesar de ir hacia una apertura, la Iglesia tenía un poder muy fuerte para, por ejemplo, disminuir las posibilidades de tener educación sexual en los escolares. Y eso ha costado mucho avanzar. Es un país donde el divorcio era ilegal, donde el aborto es ilegal, donde recién se han legalizado las 3 causales más clásicas. O sea, es un país igual conservador. Y ese conservadurismo, por supuesto que ha dificultado el avanzar más rápido con algunos elementos. Hoy día, por ejemplo, hay también más interés en trabajar sobre las disidencias sexuales, sobre los derechos sexuales de las disidencias sexuales, y eso también es una prioridad en este momento. El presidente actual, Gabriel Boric, es el presidente más joven del mundo, de hecho. Lo que no quiere decir que los jóvenes tengan poder en el gobierno. y eso también es importante. O sea, un tema es que hayan personas jóvenes y otra de que la juventud realmente adquiera más poder, y yo creo que eso todavía es algo en lo que se necesita avanzar.
Thank you very much. You know, I was on the English translation, I will own up. And probably one of the things that really stood out for me is when Honorable Jimenez said that a young person said, I had the option of choosing the life I wanted and not what culture dictated for me. That's my take home from this, from what she said. That's my take home. I know I have take homes from all the other panelists, and ladies, thank you so much for your time. I will ask you to come off stage, and there will be questions for you, so you are not, your work here is not done yet because we have a panel. So another round of applause for this amazing panel. I don't know how we are doing with our Mentimeter question, but I will come to that later because we have two more people to speak to. And then we have a session for questions. So please note your questions down. And it would be lovely if for any questions that I will take, you directly hammer these people, ask them the toughest questions. The young people, please, I am counting on you to call for accountability. They've all spoken about accountability, right? And leadership and a multi-sectoral approach, Meret's favorite quote, slogan and words. Yes, so we're going to ask them questions, but now on stage, Irum Take and Lucy Fagan, please come with me. Great to see you, ladies. So you are the last people that we are having a discussion with, and probably you will remain here for the Q&A with me because I'm not sitting here alone, yeah? Now, Irum, my first question goes to you, and it's about, you know, research and advocacy. And for organizations like yours, you know, how important is it that we factor that in, and where do you come in to ensure that we just come up with programs that support the SR, HR needs of these young people? And maybe you could also point out to some of the resources that are available that can enable them and the communities and all people who are fighting for the health and well-being to have a handbook or something to say that we can work with these to tackle these challenges.
Thanks. Can everyone hear me?
Yes.
Okay, great. Thanks, Mercy, and thanks so much to PMNCH for organizing this event. It's really an honor to be here and join my esteemed panelists. I'm Iram Taki. I represent the Guttmacher Institute, which is a leading research and policy organization committed to sexual and reproductive health and rights worldwide. I wanted to start with just a couple of striking statistics because I think they very much underscore the points, some of the points from the young leaders we heard from. According to Guttmacher data, 43% of adolescents aged 15 to 19 who want to avoid pregnancy are not using a modern form of contraception. This results in 10 million unintended pregnancies each year and 5.7 million abortions, the majority of which occur in unsafe conditions. And as we've heard, adolescents and youth face significant barriers undermining their sexual reproductive health and rights, including social stigma, provider stigma, and lack of access to SRH care and medically accurate information. In 2018, the Guttmacher Lancet Commission recommended prioritizing the distinct needs of adolescents for SRH information and services. and including comprehensive sexuality education in the essential package of SRH interventions in UHC plans. 5 years later, these recommendations are more urgent than ever. To put these recommendations into action, Guttmacher works with adolescent and youth-led groups to drive policy change. For example, we partnered with the YP Foundation, which is a social justice organization based in India. The YP Foundation asked us for the specific data that they needed to conduct capacity building, trainings, and targeted advocacy in 6 states. They also use this data in a national dialogue with the Ministry of Health and partner CSOs for government accountability. Youth advocates were really front and center in the planning and led the full implementation of this work. They had specific ideas of the types of advocacy approaches that were needed to move the needle, including targeting policymakers at subnational levels to influence, for example, budget allocations for adolescent SRH services. In Uganda, we worked with a youth advocacy organization called Public Health Ambassadors Uganda, which integrated our evidence into storytelling to raise awareness of their SRH needs in their own communities. And just as an example, they took Guttmacher's evidence about adolescent abortion rates in the country and integrated it into a spoken word piece to reach and to educate their peers. Guttmacher data estimating adolescents' unmet need for services and the impacts and costs of meeting those needs are being updated and will be ready for the Global Forum on Adolescence in October. And this is, an example of a very useful resource that has been used and will be, again, updated for advocates, especially adolescent advocates and youth organizations to use in their policy advocacy. I just want to close with just one final point. And we've heard this, I think, echoed by the speakers that we've heard from, but for evidence-informed policies to be successful, young people must be meaningfully engaged in their design, implementation, monitoring, and evaluation. By prioritizing young people's diverse SRH care needs and ensuring that they are at the forefront in identifying effective solutions, policymakers can enable young people to thrive and strengthen our collective future. Thank you.
Thank you very much. And great job working with young people. That's why we're calling and asking for today. And Lucy, Irum talks about working with young people. How do we ensure that, in the decision-making processes that we are taking, that the young people are represented and that they feel seen and heard and not just there as trophies? Like, how do we ensure that they feel seen and heard? And just based on your work, how do we ensure that for events and conferences like the World Health Assembly and the upcoming Global Forum for Adolescents, which, like I said, it's probably a term that we will talk about and something that we'll refer to a lot in these sessions, that we create safe spaces and support young people even as they go out to make a change?
Absolutely. Hoping you can all hear me as well. But yeah, I think your point is really important. And I was just reflecting as I sat in the audience listening to all our amazing speakers tonight of how invigorating it is to sit here in solidarity and in intergenerational solidarity as young people, as slightly older people, but together really with that kind of common purpose around protecting adolescents' sexual and reproductive health and rights. And it's exciting because I think we are all probably reflecting on these last few years where we have seen rights that we thought we had fought for over generations, and through our tears, through our struggles, that we had achieved some kind of recognition that these were basic fundamental rights. but we've seen how quickly decisions can change, how political leaders, how opposition movements can take a hold, and those rights that you think you have one day, you don't have the next day. And for young people, this is critical because we talk about sexual and reproductive health and rights, but we talk about it as an issue of justice. And many of us are, on the front lines in our communities, working on peer education, comprehensive sexuality education, and really fighting for these things in our own ways, building our movements. But then we see in decision-making spaces where we're not represented, people who are taking decisions about our rights, our bodies, our futures, and we have to deal with the consequences of that. And if we want young people to fight this fight, if we want them to become the next leaders who are there, making sure that in decision rooms, we're not forgotten, we have to start and bring young people in now because it's about us and it can't be without us. So I work with something called the Major Group for Children and Youth, which is a youth-led constituency, rights-based within the UN structures. And really what we do is we're a youth-led space that brings voices from grassroots youth organizations like YP Foundation you talked about into global policy-making spaces to ensure that we are there when people are talking about us and talking about our rights and that we're able to actually have our voices heard. But they're not easy spaces. CPD this year, we didn't have an outcome. Conversations that should be simple about sexuality education became, this fundamental point of discontent and disagreement. And we really need to actually be thinking about how do we build and invest and, really support youth leaders to come into this space. So this is about not just having us there in meetings once to say our piece and hold you maybe to account for a second or a moment, but it's about really bringing us into the space in our own way as rights holders, as people who should be there, not people you're allowing to be there. And this is really important for adolescents who are often spoken about, but not given voice. And we really need to also be thinking about, what does the accountability look like for this? So spaces like WHA, spaces like the Global Forum for Adolescents can be incredible spaces for solidarity, but we want to see commitments and we want to see change. So how can young people be brought into conversations to really co-lead accountability so that these spaces where commitments are made do not just end as, something that happened in November 2023 or something that happens 2 years from now, we all go home and we forget about it because young people don't forget about it. We're back in our communities battling these issues. How do we make sure young people can be brought into accountability mechanisms, and how can that happen early, and how can that happen inclusively, and how can that happen with young people at the forefront?
Thank you very much. And thank you very much, Lucy. And Lucy is our last speaker for these panels and the sessions. And like I said, you remain here with me because, any questions? My young people, oh yeah, there's a hand there. So listen, if you have a question for any of the panelists, it doesn't have to be just a room and Lucy, for any of the ladies who spoke here today, from, the Lala Merit, everybody who was here, the ministers, UNFP and Natalia, if you have questions for any of them, please let me know. We have 10 minutes to tackle this. And Lucy, I will start with you as everybody prepares. You've mentioned about the Global Forum for Adolescents and the need for accountability and all that. Just one question. Do you feel we are on the right track?
Oh, there's a question. I think we are, because I think the conversation around accountability was one of the first things we started discussing when we said we want to hold a forum. Sometimes you feel like, well, why are we holding another forum? Why are we holding another moment? But actually, it's about the groundwork that goes into that. It's about the mobilization. It's about the solidarity. It's about thinking, what do we need to make our movements work, to change the agenda? And I think that's been really exciting to see that. And one thing for me that I found really amazing actually was we brought adolescents into this planning process. So I'm a young person, I'm not an adolescent anymore, and I've had the opportunity to work with adolescents and see that kind of even cross-generational within the youth movement mentorship to say, how do we put our voices across? How do we make this a forum that's about us, that achieves the agenda that we want? And I think none of us can be complacent and say we're on the right track, we're going to get there. We need to keep thinking about that and thinking what's important to us as a community. How do we make sure that this becomes the fuel to our fire? You talked about fuel yesterday. How do we make sure this becomes that moment that really gets us fired up and gives us, the meat, the thing that we can take forward to say, this is what was committed to, this is where we're going, this is where the money is, and this is how we get there.
Thank you very much, Lucy. There's a hand here. There are two hands. There are two hands here. So those are the two questions I will take. I need to be lovely, ladies, if you direct your question to the person you want to answer it. So your name and your question, very briefly.
Okay, thank you so much. My name is Catherine Chacha from Kenya. I'm a nurse, and I'm also with Women in Global Health. Allow me say one thing. I am a survivor of FGM, which was medicalization. So I speak out openly. Because one thing I would want to ask, have you tried to use the Survivors Network, strengthening survivors to have a voice? Because as being survivors, I have two girls, one is 16, one is 14, and they have not undergone the cut because being a survivor, I know the effect and I was able to say no. That's one. The last one, medical health providers are the ones who are doing the cut. Kindly adopt the WHO concept of person-centered communication. Start this conversation with the healthcare providers for them to understand why are you saying no and why are they not allowed to have the cut, because some of them are community members and they embrace that culture. Thank you so much.
Thank you. I think that's a question for Miret, right? Is that a question for Miret? That's a question for Miret. There's a question here, and then we will get to the answers.
Hello, I'm Valeria. I'm the Swiss Youth Delegate to the World Health Organization. My question is to you, Lucy. You were talking about accountability for youth. So how would you or how should I advise my government to measure accountability for youth? We talk a lot about youth engagement and bringing youth to the table. There's so many things about youth in the World Health Organization now, but how can we actually measure it, that they're actually meaningful, engaged, and not just on the pictures and being there? Because it's nice to take pictures with young people, but how can we actually measure that they're meaningfully engaged? Thank you very much.
Thank you. One last question, then we'll go to the answers. You guys, it's nice to take pictures with young people, but they need to be. It reminds me of a colleague of mine who told me yesterday that she asked her children, can I take photos of you and put it? And they're like, no, we don't want a digital footprint. So be careful. You should be asking, what do you want? No, what do you think they want? Yes, go on.
Thank you so much for the opportunity. My name is Irabna from Ghana, and I was very excited when the honorable member mentioned that they were able to achieve the distribution of free sanitary pads that reduced the menstrual poverty bit. And I want to find out from her and from the good work that she has done so far, what are some of the lessons that other countries can draw from? And also, does she think that it's feasible for countries like Ghana, where I come from? Because for us, not only does it create the poverty, but it also leads to a lot of abuse, because when the young girls fall for the prey of men and get pregnant along the way, they are now allowed, or they are sort of very vulnerable to any form of abuse along the line. Thank you.
Thank you very much. So we'll answer those three questions. Please let the questions come. We have a bit more time. So yes, Miret, you get the first go.
Thank you so much, Mercy. And really allow me to say thank you, Catherine, for your courage to take the mic and stand in solidarity as a survivor, together with all the survivors in the world, right? You give voice to community. And I think all of us learn from you, from how do we actually use our voice to really stand in solidarity and act together so we end this cycle. So thank you, and thank you for your recommendations as well. I think the recommendations you provided are powerful because they are from a frontline healthcare worker, right? You know the realities more than, no offense, many of the policymakers and decision makers in the space who maybe are a bit more removed. So thank you for leading us also in how we should do this. We should be listening to communities. Communities should be at the center of what we're doing, including healthcare workers. This cannot be a conversation that we have alone. And Mercy will laugh at me because I will say it again, we do need a multi-level, multi-stakeholder approach at every level. We need to bring all actors into the conversation. And this is something we do regularly through my organization's work. We never demonize healthcare workers. We know that they are working also in a system that is often not supporting them. So yes, we need, I believe, in summary, a gender transformative approach to health systems and how we're doing SRHR, how we're doing everything maternal health as well, how we're doing adolescent health and well-being. And at the core of it is community at the center, empowering communities to really set the agenda. And in this case, for this conversation, it's the young people, and it's also adolescents, and it's young girls. So thank you for the question, and thank you for the challenge to all of us to really work with communities to achieve this accountability, right? Okay. Empowering, thank you to the panel that also created this space and called on all of us to hold them accountable.
Thank you,
I think that's encouraging, so thank you very much.
Thank you, Merit. Lucy, you answer the next question.
Yeah, okay, so I'm going to take this on 3 points. So I think you make a really important point around, what does accountability really look like? And how can that be, properly open, high quality accountability, not just a nod to the words. And I think it starts with a few things. So when we talk about commitments, we don't want every commitment. We want commitments that can be measured. We want commitments that are clear, they are high quality, and they make a change. So as a youth delegate, you have this amazing position to be able to say, what do young people want? And what are the kind of commitments that you can make that will deliver for young people? And how can you engage in, we call it radical transparency, but it's not really radical, is it? Let's be open, let's have feedback loops, multi-stakeholder processes, where we can check in on how this commitment's going. Because I think, we can't just rely on kind of global mechanisms to be the only place where commitments are reviewed. There's such a place for national-led accountability processes of what have we committed to? How is that going? And it's not always going to progress exactly how you intended, but how are we creating feedback loops? How are we bringing young people in all their diversity into the conversation? Maybe particularly if you're in a donor country, young people in that country, but also young people in affected populations who would benefit from that commitment. One of the things we sometimes see is, for example, commitments of investment are sometimes repackaged investment, right? They're not new investment. So this transparency is really important to be like, what is it? Where is it going? And how is it working? And I think that will be really, really critical. And then finally, just on that, I think also, for young people, there are really amazing youth-led networks in so many countries, and you need to be aware of what commitments are being made, and you need to hold your governments, your stakeholders to account to make sure that actually they are delivering on those commitments, because we see all too often commitments that fall by the wayside, that we revisit time and time again, and we wonder why nothing's changed. So you and your fellow young people, your allies have a really important role in holding that accountability in place. And if that accountability is not forthcoming, you need to push for it. You need to say, we want to see what's happening here, and we want to know what impact it's making. So I think that's really critical.
Thank you. Thank you very much, Lucy. And the third question, yes, there is.
Thank you very much for your question. And I think you raised some important points there. I guess when I first started raising the issue of period poverty, I was a first-time senator and I was still learning a lot. And I had a lot of colleagues that said, that's not really an issue. You need to talk about education. You need to talk about public transport, or, there's a lot of big issues. And I said, well, it actually is an issue. And I suppose you have to find inner resilience and confidence as well to know that you know your own mind and that you know what people are telling you. And young women that I was speaking to and young girls were telling me it was an important issue. So it's to, I suppose, block out the naysayers and continue with your path. And I suppose people in Ireland found it hard to understand that as a wealthy country that people were experiencing period poverty. They just found it hard to understand that. But when you point out that sometimes poverty can be very hidden, it can be hiding in plain sight, it might be within communities, within a school community, and it's not necessarily obvious at first glance. So that's why people have to be provided with something universally, because in a community where a lot of people aren't experiencing period poverty, it's even more important that those people have access to free products. And The other part of your question, sorry, you might remind me again. Yeah, I think that's a really important point, because what we're trialing at the moment is our pilot projects to see what the level of demand is, so we can go to the Ministry for Finance to get a fully funded scheme rolled out nationally. And it is going to be very expensive. But what we did was show that it wasn't in isolation, that girls were missing school, and that had an impact. Had a financial impact for the country, and girls were dropping out of sport as well, and what impact that had on other aspects of the political agenda. So I suppose not to keep it in isolation, but link it in with other priorities of government to make sure the funding is allocated for it. Thank you.
Thank you very much. And Natalia.
Yeah, I mean, great questions. And I just wanted to make 2 points. One is in terms of investment. What's expensive and what's affordable is defined by the population. And this is why it's great that we had the minister, we've had parliamentarians speaking today. It's clear that every dollar that's invested in PMNCH at a minimum is going to bring back 4 in cost savings, safe maternity care, as well as the avoidance of unsafe abortion. It's also saving costs on the newborn side. So I think the expenditure has to be looked at in terms of a bigger picture. It's also true that if you actually do the whole adolescent health CSE package, you can expect a 10-fold return. So this is something that I think we need to have more facility of actually quantifying, but the evidence is really overwhelming that if a girl is missing 5 days of school, out of the 28 days, hypothetically, of menstruation, that is a significant cost to the economy. The other point I wanted to make follows on something that Ministra Jimena put on the table. For adolescent pregnancy, the uncomfortable truth is that this is not a wayward girl. This is not a girl that's interested in sex. This is a girl who during COVID was home. She was home when the neighbor dropped by. She was home to be vulnerable to coercion. So as part of our commitment against gender-based violence, we have in UNFPA, for example, shown clearly in our latest State of World Population Report that over 500,000 births occur every year in an age group 10 to 14, which by definition is coercion. So again, the reluctance of us to allow children, young people, adolescents to even understand their biology, name the parts of their body, and run to the people who are supposed to rescue them and find a listener who is going to take action. These are taboos that need to be broken. Yes, it's difficult, whatever. The Commission on Population and Development is another example of where member states have made commitments and they should live up to them. Thank you.
Thank you very much. Great. I will take another round of questions and I will start with you. Oh, there's a hand here, there's a hand back there, and one more. Great. So let's start here. And please let us know your name and who you want to answer your question.
Yes, my name is Yahan. I'm from the International Federation of Medical Student Associations. So I'd like to start off by thanking the panelists and the moderator for this wonderful session, and especially for sharing stories around FGM. So caring for patients with FGM and other unique and diverse needs has been something our standing committee on SRHR has been advocating for. So last year we had a survey that involved more than 350 medical students. They showed that our medical student had much less confidence in managing the health problems of adolescent patient compared to, for example, pediatric patient and also patients aged greater than 25. So my question is toward all panelists. So do you have any suggestions on how can we better integrate adolescent health in the medical curriculum, especially for those adolescents with more unique and diverse needs, like, for example, those identifying as LGBTQIA plus groups, refugees and migrants, and those living with disabilities. Thank you.
Thank you. That was open to all panelists, so please be prepared in case I pick on you. If somebody doesn't volunteer, I'll have to pick somebody to answer the question. So I hope somebody volunteers. There's a hand there. Thank you, Dr. Natalia. Bye.
I'll stay sitting if that's okay. So my name is Regina Keith. I'm working with the University of Westminster, and those of you who have been around for a few years know me. I'm one of those dreaded health workers. I'm a midwife for the last 41 years. But first of all, I'd like to say thank you for all of you to come here, because some of us was in Sweden about 20 years ago when we had the global adolescent strategy, and one poor Zimbabwean girl was called up to tell a poem. And I saw her afterwards. She was a wonderful girl, a wonderful poem, but she was eating a tub of ice cream outside because she was so stressed because she'd been put up in front of a public without enough preparation. And so we have come away that we're in a room now. Not everyone's here yet, but you have a voice, we have more voice, and you did let people speak today, which didn't happen the other day. So again, this is the forum. So well done. So we have to say there has been some progress, but not enough. And so the statement that you made a minute ago is, and this is my question, global accountability. So we agreed on the Women and Children's Strategy when we co-wrote it. Many of us in this room were part of the writers. And you know, that number 7 on the agenda, which was all countries to develop a mechanism for voices to feed into policy and practice. So my question is to my home colleague from Ireland, what are we doing in Ireland? So nothing I've seen recently, although she's doing some great work with Sinn Féin and stuff. What are we doing in Kenya? Actually, we were doing great work in Kenya before, 20 years ago. I don't know if there's anything's progressed. So I would love to know, and then I would like from the young people to know, what do they think we could do? Because really, it's been the least amount of reported on the accountability framework. In fact, I haven't been to a meeting in 20 years when we've actually reported on what the countries, there's lots of pilots. I can tell you pilots in every single country in this world. But what national program do we have for this? And what do you think we can do to start changing that? Because we need to change it.
Thank you very much. Definitely, that's a question for you, Ruth, because she mentioned Kenya. That will come to you. But I want somebody to take Regina's question from the panel. Senator? All right.
For another Irish woman, I'm going to have to answer that. What specifically about Ireland were you? Yeah. Yes, there is I don't have the exact long title in front of me, but it's a National Women and Girls Health Strategy. Our current Minister for Health, Stephen Donnelly, took up office just over 3 years ago, and he's been particularly focused on women and girls' health, and he's made great strides in relation to it. But in relation to the accountability piece, I'm not sure if I have that exact information, but I take your point. Thank you.
Thank you very much. And I'm going to end up there. But before I end, there was a question here about medical students and their capability of handling issues around adolescent. Yes, integrating adolescent health in the medical curriculum. Very, very briefly. Ruth, do you want to take that? Or we go to Jimena? Yes? You want to say something? All right, I'll come to that. I'll give you a chance now that the panelists are very briefly. Do you want to respond to that question? Yes, curriculum integration. Very briefly. And your name, sir?
This is Professor Mohammad Titumia from Bangladesh. I'm working as the Director General of the Medical Education. That's why, because I'm taking care of the medical schools and also the technology school and the medical assistance school. So you know, this is very much pertinent. Someone has asked about how the issues regarding to the illness of the adolescents could be addressed. Yes, first of all, I'd like to thank the organizer for coming to these issues. Yes, definitely the adolescents is a huge bulk of populations who are remain under-addressed or very much neglected. And medical curriculum like Bangladesh has been introduced in their curriculum about the adolescents' health. Also the reproductive health, the family planning is taking care of the special care about the female, the young girls. And also the young boys also somehow suffering from some psychological problem, and also at the verge of their puberty, they are having some problem, which is very much neglected. And they could not understand what is the changes going on in their, the bodies due to the hormonal changes. So these are the things are definitely from the WHO should have a recommendation. Some countries are taking care, included these into their curriculum. This should be universal. And definitely the other things has been discussed. The strategy for every country, the government is taking care. Say a country like Bangladesh, the government, our honorable Prime Minister has taken the steps to inhibit the premature marriage. You know, in our country, most of the marriage, a handsome amount of numbers are married in the early ages, even before the age of the 18. So these are very much related to the increase, the maternal mortality and also ill health of the children. So these are the issues we are taking care. Thank you very much.
Thank you very much for stepping in. And now I'm seeing many more hands. And unfortunately, I have to end it there because I think the people who are serving wine are getting tired and we need to go there. And I know some of you are really waiting for the wine and the bitings and the water. Okay, the water and the juice as well. They're getting tired holding the glasses, so I'll have to end this there. And now go to Dr. Chandra to just give a reflection of, what has been said here and how we're moving. Chandra, you're welcome.
Thank you and good evening. Wonderful presentations, lively discussion. I have 3 points. One is Kenya, Chile, and Ireland have shown what bold leadership, good science, investment, and action can achieve. And Regina, those are programs at the national level. They are not pilots. And there are increasingly numbers of countries which are doing large-scale programs. That's point number one. Point number two, Natalia and Iram have talked about the huge unmet need in adolescence, the huge levels of problems. But let's not only talk about levels, but talk about trends. In the last 10 years, HIV rates in adolescents have declined, childbearing rates in adolescents have declined, female genital mutilation rates in adolescents have declined, and we need to celebrate this success. It should be faster, it should be more even, but we are not stuck where we were 15 years ago. And by celebrating this, we can encourage others, motivate other governments to do more, and get funders to put more money on the table. If Kenya can reduce FGM, Tanzania should. If Chile can reduce adolescent childbearing, Brazil should. And that's the pressure that we need to do. We saw the Millennium Development Goals and the pressure that it put on countries to reduce childhood mortality, and we should do just this. And my last point, today is a meeting on adolescent sexual and reproductive health. We have not talked so much about mental health. That's come on the agenda now. But the 25 years of learning that we have on adolescent health can be used in other areas. Contraceptive counseling can feed into mental health counseling. And we need to do that, learn more. So to conclude, the glass is not full, but neither is it empty. And together, we can slowly fill it. Thank you.
Ooh, thank you so much. We are not there yet. And like I said, we are in a fueling station. We have come to fuel, then we go on from here. Now, before I hand over to Helge to do the closing remarks and invite us to the reception, there's a Mentimeter question that I asked all of us to fill in. I don't know if we have any results and if they can come up now. Did you people ignore me? What? Did you feel the Mentimeter? Did you feel it? No Wi-Fi. Oh my goodness. No Wi-Fi. We did 4 virtual lives in the balance events over Wi-Fi. It's good we don't have Wi-Fi here. What did you feel?
I felt that the young people participation and decision making is the most important.
Thank you. Karen, what did you feel?
I felt the same.
The same. What did you feel?
Political commitment and listen to the adolescents, learn from them.
Political commitment, listen to the adolescents. What did you feel, my dear?
Yeah, to listen to the voice of youth and make sure that they have their opinions are taken into account and they're involved in decision making in all aspects of all processes.
Thank you very much. So we are on the right path. Now, before I hand over to Helga, give me just a minute. Senator, please stand here with me. I'm sorry to put you on the spot. How are you feeling?
I'm feeling good. Yeah.
You are missing something very important today. Are you missing something at home?
Oh, yes. It's my son's 6th birthday today. And because of COVID, he never had a birthday party until now. I've missed
And you've missed a party again. Oh my goodness. I have a 6-year-old daughter, so I can imagine how and what all this means. Will it make you feel any better if we sing a happy birthday for him?
Yeah.
Yes? What's his name?
Teddy.
Teddy. All right. Who is leading us? Helga, come. and then you close, right? So here you go. Yes? Happy birthday to you. Happy birthday to you. Happy birthday, dear Teddy. Happy birthday to you. Yay!
Thank you so much.
I hope somebody took a video of that so that you can have it up. Well, dear partners of change, we've come to the closing, and let's just remind ourselves why we're here. We're here because the number is 1.8 billion of a population that has never been so big, and their problems have not been visible. And why is that? Because what we've heard today, little stigma about not knowing, actually, there hasn't been that kind of knowledge on well-being. And also the monitoring framework has been missing. And also what does really meaningful engagement mean? And we at PMNCH, together with partners, together with the UN and academic research teaching institutions, have then put our efforts together. And it has taken years, but better to do it properly. And to then establish a framework and a definition for adolescent well-being, which contains 5 domains, of which one is health and nutrition. And so these are important, and these we will make known, and it will provide a platform for programs, national programs, to look at and to seek guidance from the UN. So that is important, but we have not stopped there. We are together with 5 UN agencies and the GAMA partners developing a monitoring framework, because we know what does not get counted does not count, because it is invisible. And so we must make it visible. And that is what the efforts have then been. We have gone a step further in, together with academic research teaching institutions, in doing the investment case. Because we know, and you don't need to be a health economist to know that you need to make the case to the Minister of Finance when you need to identify what interventions and their return on investment in each of the 5 domains. And they will fall in several sectors. So that is important. And I just want to point out, Anshu, please stand forward, Etienne and Tahira, please. If you want more information about the evidence related to this and the work on the investment case or the work on the monitoring framework, please use the opportunity of the reception to go and seek more, and also the guidance that WHO has then updated to include this. Lastly, but not least, we have used a lot of efforts together with the Global Forum in relation to the Global Forum for Adolescents to not make it one conference. We wanted a lot of involvement simultaneously in many countries. And to date, I'm told that we have 49 of these national events that will then occur. Our aim is to have 100. So please, if any of you want to take a lead or be a part of a national event and make the involvement of a community, please get in touch with Tahira or Anshu and say how you can get involved, because we want that. The other thing we have heard today is nothing for us, without us, and by us, and in our lead. And this way we have been very truthful in PM&CH, as all of our positions in governance are actually co-led by young people. And we have also we are also trying to involve 1 million young people in this effort, so that it doesn't become only a research effort, but it becomes one that 1 million voices are being heard, and what young people want is part of this. And also their stories is a crucial point behind the statistics and in front of the statistics. So that is really critical. I want to also leave one more thing with you, and that is that we have also, in the last, I think, 5 years, used a lot of effort in establishing what is meaningful youth engagement. And we, together with partners and youth-led organizations, have developed a checklist. We have also developed an accountability report, and we have also developed guidelines. Please, if you would like to use this in your organization, please feel free to go to our website and use it. This is for all to follow, and we will then assess what kind of an accountability framework can be actually used in the future in order to ensure that this becomes a really live activity that everyone takes and does actively. So please use the reception to ask more questions or to get involved. Flavia Bustreo is, and Flavia, I'm going to make you stand up, is lead of the Global Forum for Adolescent on the political commitment. And so if there is commitment from different constituencies or from governments to be done, or parliamentarians to be done for this issue, then please get in touch with us, and we will capture it and amplify it. And it will be used as in order to then motivate other countries, other organizations, other partners to do the same. So please, this is something that we want to really move strongly with, and so that at our next milestone, we see progress. We are a steady line of what Chandra usually calls, very optimistically, it's a half full glass, and we are going on our way to make it full, with all of this knowledge and all of these tools that we hope are very useful to all of our partners. Thank you so much, and the reception is open. Thank you.